Let me start by welcoming you all to this special, the extraordinary meeting of the Group of Friends of Haiti. I want to specifically welcome our permanent representatives and delegates to the OAS, especially Ambassador Brutus, who will speak to us later at the end when we make closing remarks. And of course, we like to welcome our permanent observers who have been so supportive of Haiti, representatives of international regional organizations, our sister organization, or daughter organization, the Pan American Health Organization, and others. And we will hear from you later on. Representatives from the diaspora, as well as from the Pan American Development Foundation, who have been so kind to lend us one of their experts, and our colleagues from the OAS, representatives from the media, the presentation from the Pan American Health Organization, from Mr. Jon Andrus.
Mr. Ambassador and others here, I'm delighted and honored to be here, particularly to represent the Pan American Health Organization and our director, Dr. Mirta Rosas, and have a chance to share with you what's going on with the cholera outbreak in Haiti. I'm going to divide my talk into two parts. Most of my talk will be covering what we're doing, we and other partners, to respond to this crisis in Haiti, and start off by just giving you a brief summary of the epidemiology, but spend most of my time covering what action, what response we're organizing, particularly looking through the eyes of the Pan American Health Organization. I come from the world of immunization, so I'm going to try to avoid talking about that. In a former life, that's what I did. But I may end with some comments about the role of the cholera vaccine in case some of you are curious. So to summarize, last Wednesday, the Haitian Ministry of Health was informed or noted that they had increased cases of diarrhea. One of the consequences of the response to the earthquake was the establishment of what we called an early warning system of surveillance, to really have out there in the field a way of detecting at the earliest possible moment, the potential, say, for pneumonia outbreak or diarrhea outbreaks. And as a result of that, the Ministry of Health of Haiti was able to detect that there was a potential problem and looked into it, and the next day, sure enough, we were informed that a case of cholera had been identified. The bacterium had been tested and isolated. As of today, as of this morning, the Ministry of Health has reported 4,147 confirmed cholera cases and 292 deaths. Cholera is typically a highly infectious disease. Our experience in the last outbreak or epidemic in the region was in 1991. And we're following a similar course with a very rapid, steep slope of the epidemic curve. So if you plot cases on a timeline, you'll see a rapid, very steep slope of the numbers of cases occurring. And that's indeed what we're seeing in Haiti. Most of the cases are from Arbanite. And if you know Haiti, Arbanite has the Arbanite River. There's a basin with many tributaries, and indeed we believe that the river is the source of contamination. But there are other infected departments, namely Central Department and the West Department. But most of the cases are coming from Arbanite. There are also suspect cases being worked up that are from Northwest, Northeast, and the North Departments. And I should report that although no cases are being reported from the Dominican Republic, the question is, do we expect cases? Most definitely yes. This is a porous border. Anybody that's worked in Haiti or in the DOR knows that this border is very porous, and that when we speak of the elimination of malaria or filariasis or any disease on Hispaniola, we need to be talking about island-wide approaches because of how porous that border is. Just the map, I mentioned the river as it goes from the east to the west to empty into the part of the coastline where St. Mark is, where the first cases were reported. I summarized the data as of today and noted that we have 3 departments now that with confirmed cases, in addition to Center, Arbanite, and the West departments. For those of you that don't know about the cholera infection and its basic epidemiology, I'd like to just highlight some key points here, that it is an acute diarrheal infection that is transmitted primarily through contaminated food and water. People often ask, well, is there human-to-human transmission? It is possible, but it's rare. The vast majority of the cases are due to the exposure to contaminated water and food. And that leads to what the intervention is. And it happens to be a very effective intervention. If you wash your hands, you provide safe potable water, you provide sanitary services, you can control and stop transmission. We also have in addition to the preventive measures to reduce the numbers of cases or reduce the spread of infection, we have measures that are highly effective in minimizing the number of deaths. And those measures are largely revolve around the use of the oral rehydration salts, which we've been using for some decades now, that have saved millions and millions of lives in developing countries, particularly children. Where if you keep up on the fluid loss, if you keep up with the oral rehydration salt replacement, you can prevent the child or the person from going into severe dehydration that becomes irreversible and is eventually the cause of death. And we think that just about 80% of the cases can be managed in this fashion. So other cases go on to more severe presentations because they may not have access to the therapies or the interventions, or may not be in a they come from, in particular, vulnerable populations. Cholera has not been reported in Haiti. Some experts say for more than a century. I mentioned the outbreak that started in Lima, Peru in 1991, which spread to virtually all the countries of the Western Hemisphere within a matter of a month or two. And that epidemic lasted for several years. We've had sporadic outbreaks up until most recently in these 6 or 7, 8 years ago in some countries. We know that based on the experience in Peru in particular, this outbreak will not go away despite all our interventions. There will be endemic disease. There will be cases over the next few years. And that requires a long-term strategy and a long-term commitment from partners supporting the Ministry of Health Haiti and program there. So it will require long-term strategy, and I think this is a very important point to recognize. So our response, we've been working in very close collaboration with the Ministry of Health through our focal point there, our country representative, Dr. Leah Guido, who on an almost hourly basis is in communication with the Ministry of Health. And we've been able to mobilize teams of experts that cover emergency management, epidemiology, surveillance, water and sanitation, the management of dead bodies, which I'll get back to, and the risk communication, to communicate appropriate messages to the community, because that's really where most of the prevention and most of the treatment can actually take place, at the family level. We've produced multilingual technical guides and have them on our website, and sharing this information and updating old versions from previous experience in 1991, and mobilizing experts that actually have had experience with cholera throughout the region, namely with the 91 epidemic. And as the leader of the health cluster, we collaborate with a number of organizations and governments and the inter-American system that we are fortunate to have in place in the Americas. You may know about the ProMess warehouse. This is a warehouse that PAHO, in collaboration with the Ministry of Health, manages the purchase and supply of medical supplies and equipment, vaccines, for example, IV tubing, the oral rehydration salts, the antibiotics needed in this outbreak. And so that is being managed, and at the moment is well stocked. But we're going to see this outbreak spread, and there'll be more cases, so the challenge is to be sure we're on top of it and we keep it well stocked, and we maintain the capacity to respond to emerging cases. We are working with partners to estimate or project what additional cases may come, and so we're using that information, using it to plan appropriately. We also work with the United Nations agencies to coordinate donations to respond to this. I'll get back to that, but we've already had immediate response, for example, from Spain, and also one from Canada that helped us in the early days. I mentioned earlier the courses. In many countries of the world, depending on the culture, a dead body may remain in the household for some days, and that may be a source of exposure and contribute to transmission, actually, which has been documented. And so that's a concern that we must manage, and so we're mobilizing experts with experience in disposal of dead bodies, for example. We're also working with a number of ministries of health throughout the Caribbean and Dominican Republic, as I had mentioned, getting them prepared for potential increased risk of infections to come in the future. The Ministry of Health, with PAHO support, developed and other supporting agencies developed a national response strategy that they presented to all the partners yesterday. The main three prime objectives or lines of action of this national response, in summary, covers anything that will help prevent spread of the transmission, so prevention, and then anything that would minimize mortality, minimize the deaths. And the three broad areas here are protect families at the community level, strengthen primary health care services, and establish a network of cholera treatment centers and designated hospitals for those severe cases. We have the international support with the help of Brazil donating chlorinated material, other medical supplies, and sending teams of experts to Haiti. I mentioned Spain and Canada's immediate response to financial needs. We've benefited from the support of countries like Japan and UK, who during the earthquake and subsequent time after the earthquake supported the surveillance and the development of the early warning system that's helped us with the detection of this current outbreak and the response to it. And we do need additional support, and we're coordinating that. I'll just end by saying that at PAHO we have an emergency operating center that we mobilize for the H1N1 outbreak in the region, and we also mobilized again for the response to the earthquake. We're currently working 24/7 to meet and support the needs of the peoples of Haiti. You see there the contact information if anybody in the room would like to contact us, have any questions, or there's any potential opportunities for collaboration. So basically, I would like to end my talk with what I mentioned at the beginning, give me a chance to talk about vaccine, because we get many questions. We have these very highly effective preventive measures, treatment measures, but we happen to be the beneficiaries of vaccination in the region. We're the only region to have eradicated polio, measles, and rubella, and so we've benefited from those technologies. The vaccine that is available, there's three vaccines. There's an injectable vaccine that doesn't confer immunity very long. It has early waning immunity, so we at PAHO and at WHO do not recommend use of the injectable vaccine. There are two oral vaccines. They're more or less very similar. They have to be given in 2 doses, spaced a week apart. Immunity is not confirmed until at least a week after the 2nd dose. That leads to our recommendations. During an outbreak, we do not recommend vaccination because it takes so long for, after 2 doses, to confer immunity. By then, the infection is everywhere, and you're being exposed to it. So those simple measures that are highly effective, we receive such marginal benefit by diverting resources and attention to vaccination that we say no. Stay focused on those simple measures, stay focused on surveillance, stay focused on prevention and treatment, and not divert the attention for that. That's very clear-cut in an outbreak situation, and I think most experts of the world would agree with that. Now, there are questions of, well, what if you're in a community, particularly a vulnerable community, that's at risk to exposure or spread of this outbreak to that vulnerable community? And so we're in discussions with our technical colleagues, and if there is sufficient supply of vaccine, there may be opportunity, for example, in the peri-urban slum area of Santo Domingo, to go in and vaccinate in advance of the epidemic reaching Santo Domingo. And I think we can use that opportunity to study and demonstrate that we save lives, and that would be an excellent thing to do. But right now we're trying to determine whether or not there's sufficient global supply. Our first information indicates that there is not. But just to share with you that we are looking into this. Now, we get a lot of questions about, well, do we vaccinate health workers? Do we vaccinate our staff? Do we vaccinate people going to Haiti? The answer is no. For those reasons that I mentioned, simple hand-washing measures. There's no evidence in the scientific literature that health workers who are seeing and treating patients on a minute-to-minute basis who are exposed, if they wash their hands between patients, there's no evidence in the literature that indicates they're at risk for being infected or being a vehicle of spread of infection. We do see that, however, with measles, because the measles, if I'm infected with measles today, my highest, most intense, how shall I say this, the day before the onset of symptoms, I'm most infectious. So I could be caring for patients when I don't know I'm infected, but I'm exposing my whole waiting room to this virus. And indeed, health workers in measles outbreaks, if they're not vaccinated, amplify transmission. And that is not the case with cholera. So what we do at PAHO, we're not vaccinating our own staff who are working there, going out in the field, investigating cases. We don't vaccinate our scientific experts that we've been mobilizing, sending to the countries, nor are we recommending that. And so I think I'll just end by with that statement, and thank you for inviting us.